Have you seen this really alarming TikTok trend that's going around at the moment where young people, I'm talking about 18, 19, 20, are going abroad, having their teeth cut down to pegs, claiming to have veneers done, and then flying back and showing the procedure off to get more views and likes? It's super distressing, especially for a dentist, and I'm here to tell you why. You may think, what's the big deal? They have nice teeth, doesn't matter, they're getting it done. I'm going to tell you 5 main points why you shouldn't be doing this and what the dangers are. But before I go on to that, please don't forget to subscribe and like to my channel so you've got all the information that you need on different topics, including and lifestyle. So let's break it down first of all. These pinpoint preparations are actually not veneers, they're crowns. What's the difference? Veneers means that we actually shave the front surface of the tooth. We do several preparations, take records, and cement a thin porcelain shell on the tooth. Now, hopefully they're quite conservative preparations these days. Certainly if we straighten the teeth first, and I do have a video on this as well, the teeth don't need to be cut down a lot. If the teeth are very crowded, you will need aggressive preparations. And indeed, a lot of the cases that I've seen, some people have completely virgin teeth, but some people have very crowded teeth, which means the teeth cut down even more aggressive. If the teeth are cut all of the way around the tooth, they're crowns, they're not veneers. So we're cutting every surface, whereas veneers just relates to the front surface. Why is this important? Okay, let's look at a tooth. A tooth is made up of different layers. We've got the outer hard layer, which is the enamel, the inner more yellow layer, which is softer, called the dentine, and we also have the nerve. They all function together and properly to protect you, and we are biologically perfect to ensure that this happens. But the more you cut, the more enamel you're taking, the closer you are getting to dentine and possibly even the nerve. And indeed, in some of these cases, you get what we call pulp exposure, which leads to root canal. So what does it mean for the future? Well, it means that the teeth are going to die, so you're going to get lots of root canal treatment because we're getting closer to nerve. And importantly, some of these crowns may fail because they snap at the gum line. So basically, the strength of a restoration, i.e. a veneer or crown lasting, depends on its ability to bond well to the tooth. But if you also have a tooth that's so small, the ability to bond or glue to the tooth becomes weakened. Also, with a pinpoint preparation, when you bite down, the tooth experiences flexural changes, which means that it's going to snap. So over time, you're looking at root canals, teeth breaking at the root, pain, sensitivity. So minimal preparation is the way that you want to go. Sometimes it's not possible, but definitely in the case that I've seen, especially the ones with virgin teeth, it's 100% possible. And you could achieve the same results with some whitening, some straightening, some bonding, or minimal prep veneers. Okay, so that brings me on to point number 2. Do you think these bad boys are going to last you for the rest of your life? Absolutely not. They're going to need replacement. Crowns or veneers need replacement every 5 to 10 years or more. And if they're not cemented well or done well, even more frequent replacement. So some of these people that we're seeing, the really young ones, 18, 19, 20, as I said, they're going to be getting them replaced every 5 to 10 years or more. Where are they going to end up when they're 40? They're actually going to end up with no teeth, so they're going to end up having implants or dentures. And that's not the way that you want to go. It's really expensive. You're looking at thousands and thousands of pounds upon treatment for the rest of your life. And if you can't afford it, having dentures flapping around in your mouth is not ideal. It can hamper the way that you feel, the condition of your mouth, the way that you function. So it's not the way that you want to go. And let's go on to my third point. What happens if something goes wrong? Even when I use gold standard techniques or do my best to provide the best care for my patients, sometimes things go wrong, right? Like a little bit of cement has been left in between, they can't floss, or they are experiencing a little bit of pain, sensitivity, or need adjustment on the bite. I can tell them to pop in literally on the same day. What are you going to do when something goes wrong when you've gone abroad? Fly back? What if you can't fly back? What if it's during the pandemic, or you got it done in the summer and you needed to fly back? You just can't. So really, you want to think about ensuring that you can go and see a dentist again if something is wrong. And that brings me on nicely onto my fourth point, aftercare. One of the most important things about veneers or crowns is the maintenance. I actually say my hygienist is more important than me when it comes to the after, because they need to be going in regularly to have their gums checked, to ensure that cavities haven't started anywhere, to ensure the diet's all good. You need these healthcare professionals. So it's not like you can just go for this 24-hour trip and never see a dentist or hygienist again. It needs way more maintenance actually than your natural teeth. So again, who are you going to go to for your aftercare? And if you see a dentist or hygienist in the UK, for example, and they see that something is wrong with your teeth, teeth, they're not just going to say, oh, that's fine. They may inform you, and if you need any work redone, replaced, corrected, you're probably going to be charged double, triple, quadruple the amount that you paid by going abroad. So the financial implications are huge, and is it really going to be worth it? I want to give you an example actually of a case that my colleagues saw. A patient had gone abroad, had totally virgin teeth, got a full set of crowns, and they kept falling off. They just kept popping off. Dentists kept gluing them back in. Some dentists wouldn't touch him because they knew he'd had it done abroad. But the point is that my colleagues saw him, and we recognized that because of his bite, the crowns kept falling off, and he actually had to have a gum lift or crown lengthening surgery, where my colleague lifted the gum, removed the bone, repositioned the gum, redid the crowns at a higher height, and the patient then was happy because nothing kept falling off, but he completely regretted it. And guys, you don't want to end up in that. You know, it is a pretty gruesome picture, and you know, it's not something that you want to end up doing. So please think carefully about making these decisions. That brings me nicely onto my last point, which is you're there for 24 hours. Do you really think correct diagnosis and treatment planning can be made in such a short space of time? The point is that usually when you contact these centres abroad, they just make you fill out a form online. They haven't seen you, they haven't checked your jaw, they haven't checked your bite, they haven't checked all the other things that are going on, you know, which takes a really, really long time. And often with my treatment plans, they can take a year, 1 year, 2 years or more, depending on the case and what's suitable for the patient, and picking up on things like jaw problems, you know, which if you get a full mouth crowns can exacerbate it even more. So having this 24-hour trip sounds ideal, great, I don't have to see a dentist, I'm in and out. It's not realistic, right? Because you've got to think about the whole process really being a journey, not just, as they say, it's a marathon, not a sprint. And that's exactly what it is with dental cases. Of course, some cases can be quicker, but more often than not, especially people that do have big problems and do choose to go abroad because they just want to be done and have a quick turnaround. So guys, do not listen to these trends. Speak to your dentist. Veneers can be bad in some cases, they can be great and suitable in other cases. Completely depends on the case, and at the end of the day, you need to know what you're getting yourself into. Please do not forget to subscribe and like to my channel so that you can get more information. Have a great day, guys.